Hello, everyone, and welcome to this audio podcast. This audio podcast as part of a Meteor edition. This audio podcast as part of a Biome bullet. This audio podcast as part of a Lobostic Phantom, and this audio podcast as part of a Storm Lobostics production. In this audio podcast, looking at a research poster presentation, sort of collaborative works in as part of as part of a research poster presentation from 2022, where this research poster presentation looks at a specific and particular kidney condition, a particular kidney condition referred to as Henoch-Schönlein purpura, or HSP. And this research poster presentation is collaborative works between two academic institutions and the social media platform, the Renal Patient Support Group, the RPSG. This research poster presentation looks at Henoch-Schönlein purpura in context of biomedical and clinical anatomy practice on this multidisciplinary MDT disease or condition. So to begin with, some intro. In this intro, there will be a sort of a look at the epidemiology and look at sort of aims and objectives, and look at some underlying literature in regard to biomarkers and HSP. Henoch-Schönlein purpura, or HSP, is characterized by a triad of symptoms or symptomologies. Number one, palpable purpura without thrombocytopenia. Two, abdominal pain, and three, arthritis. Renal involvement or kidney involvement kidney involvement or renal involvement often occurs in amongst pediatrics, or children who are diagnosed with HSP. So it is a more frequent in amongst males, and in spite of its being a self-limiting condition, HSP can cause renal manifestations with various indices. The guidelines and treatment for managing in such patients or recipients ranges between pediatric and specialist hospitals. Long-term prognosis depends mainly on the severity of renal involvement, which may manifest as persistent hematuria, where there's blood evident through voiding proteinuria, nephritic and nephrotic syndrome, or even end stage renal disease, or end stage kidney disease. And to prevent or delay end stage renal disease, identification of early stage nephritis is crucial. So the risk factors associated with renal involvement in HSP are not clear, although epidemiological and clinical features, as well as abnormal laboratory findings, have been suggested to have a sort of predictive basis. So now looking at some of the epidemiology before going into the aims and objectives. So Henoch-Schönlein purpura is one of the most common vasculitis vasculitis or conditions in children, or pediatrics occurring in 8 to 24, sorry, 8 to 20.4 per 100,000 children per year. HSP usually occurs in children aged between 2, can occur in children pediatric in amongst pediatric children, pediatrics and children, or young people between 2 and 10 years of age, with 50% of all cases occurred, or 50% of all cases occurred in children, or young people aged less than 6 years, mostly in children or young people aged 4 to 6 years, four to age between 4 and 6 years. Although it is generally a self-limiting condition, HSP can cause acute gastrointestinal manifestations, bleeding into suspicion, and or renal manifestations with various incidents. Age of onset is a suspect risk factor for renal manifestations in HSP. Etiology of HSP is unknown, although a variety of antigens such as infections, vaccinations, drugs, foods, and insect bites can trigger the onset of HSP. The disease or the condition is characterized by deposits of immunoglobulin A or IgA, which contained immune complexes and complement components in small blood vessels, blood vessel walls. It is generally agreed, or has been amongst the literature, that the incidence of HSP decreases with age, and the proportion of children or young people presenting with renal involvement reported in studies varies from 10 varies from 10% to around 20%. Now looking at some aims, objectives. The aims of this research poster presentation was: 1, to provide a practical understanding of HSP. Number 2, to provide an understanding of what further multidisciplinary care is required for patients with HSP. And 3, to highlight how laboratory practices could be enhanced to support the development of HSP care guidelines. Before going into looking at HSP practice or practices, I look at some works in around biomarkers. So there are no specific diagnostic biomarkers of HSP. If present, anemia is usually a result of gastrointestinal bleeding, or associated with acute nephritis. Thrombocytosis is a feature that may be related to disease severity. Renal involvement results in hematuria with or without proteinuria, which may be in the nephrotic, and may be within the nephrotic range. A rapidly progressive nephritis may result in renal insufficiency and requires histological assessment. A particular investigation referred to as von Willebrand factor antigen is synthesized and is present in endothelial cells. High concentrations have been high concentrations have been detected in patients or recipients with HSP with other vasculitic diseases or conditions, probably because of vascular endothelial damage. Excuse me. An association with disease activity has been noted. This may be a useful sort of marker, a useful marker of disease severity. Soluble thrombomodulin is derived from damaged endothelium, which may reflect endothelial injury. A, uh, just to also sort of additionally inform when endothelial injury is evident, with HSP with HS with HSP with HSP with HSP symptomologies, again palpable purpura without thrombocytopenia, and 2 abdominal pain, and 3 arthritis, for example, then physicians and clinicians would look to prompt particular laboratory pathology requests. So raised serum thrombomodulin concentrations have demonstrated in patients or recipients with HSP nephritis. Routine coagulation investigations, so blood clotting investigation tests are normal or tend to be normal, while factor 13 activity has been reported to be low, especially in recipients with severe gastrointestinal conditions. So now looking at sort of HSP practice. So renal involvement rarely precedes the appearance of purpura, and usually occurs within the first 3 weeks of the illness or the condition, and it ranges from isolated microscopic hematuria, proteinuria, or nephrotic syndrome, and wherein there is more than 3 grams per 24 hours more than 3 grams per 24 hours where proteinuria exists in adults, in young adults, and 40 milligram per meter square per hour in children and pediatrics, or children and young people, and to acute rapidly progressive glomerulonephritis, and it can be associated with either high arterial blood pressure or renal failure, or both. Excuse me. Depending on the diagnostic criteria, the frequency of renal involvement varies from 20%, anything from 20% to 100%. Overall, an estimated 2% of children or pediatrics, children and young people with HSP experience ESRD, or end-stage renal disease. In one investigation, the frequency of CKD, chronic kidney disease, in adults or young adults was estimated to be around 1%, and that of end-stage renal disease to be to be just less than 1%, and the frequency of renal failure was reported to be 10. The frequency of renal failure was reported to be 10 to 20% in adults, and 1% in children, pediatrics, children, and sort of young people. So retrospective cohort investigations have revealed some essence of initial renal involvement in about 20 to 54% of HSP patients or recipients, ranging from sort of isolated hematuria and or proteinuria without any abnormality in renal function or arterial blood pressure, to acute nephropathy with renal impairment. Um, and gross microscopic hematuria, proteinuria, or nephritic syndrome may occur. May occur. So now looking at sort of MDT, or multidisciplinary team laboratory practice. So streptococcus vaccines and viral infections, measles, varicella, rubella, hepatitis A, B, A and B, tuberculosis, mycoplasma, Helicobacter pylori, are stated as sort of the triggering factors, in amongst the evidence. This is a multidisciplinary disease or condition that affects the skin, joints, gastrointestinal system, the kidneys, and in addition, more rarely can have effect on the central nervous system, the central nervous system, the cardiovascular system, and in amongst males, where, for example, the urinary tract, urinary tract, and sort of the prostate, where the prostate can be affected. Its pathogenesis and causal factors have not been accurately identified. Viral and bacterial infections, drugs, vaccines, food allergy, and even insect bites have been considered in the etiology of HSP. It is thus important to appreciate that when supporting clinicians with laboratory diagnosis, HSP requires a multidisciplinary team laboratory, laboratory practice, and within the research poster presentation, there is a look at the different aspects of the multidisciplinary team practices, which will be informed as we go as I go through going through the poster presentation. So reduced glomerular filtration rate, or GFR, is linked with worse long-term renal prognosis. Early identification of impaired renal function is an important part of biomedical practice and disease progression. Hematuria is commonly present in HSP nephritis, and usually runs a benign, or not a sort of a benign basis, where when isolated. Macroscopic hematuria for more than 7 days in specific particular cohorts is rare. is rare and would require is rare, however, would require further investigations to explore differential diagnoses. In on this research poster presentation, just a look at sort of biomedical and clinical anatomy practice. So the defining features include sort of most common systemic vasculitis, a sort of conditioning amongst pediatrics or young recipients. Can be in amongst pediatrics and young people can be vomiting, abdominal pain with gastrointestinal bleeding, arthralgia where there's joint pain, hematuria, proteinuria, nephrotic syndrome, systemic small vessel leukocytoblastic vasculitis, purpuric skin lesions on extensor arms, legs and on sort of around the legs areas. And in regard to a criteria for hospitalization, so there's in around criteria for hospitalization amongst HSP recipients or suspect HSP recipients is the inability to maintain adequate hydration with oral intake, severe abdominal pain, or significant gastrointestinal bleeding, changes in sort of well-being status, severe joint involvement, limiting ambulation and or self-care, renal insufficiency where there's elevated creatinine, arterial blood pressure, and nephrotic syndrome. In regard to laboratory investigations and sort of some of the typical sort of findings. So for the full blood count, there can be a full blood count may indicate anemia or anemia and leukocytosis. Erythrocyte sedimentation rate or ESR, where it's normal, can be normal or slightly raised, and not indicative for HSP alone. Around the biochemistry, the renal function may be abnormal with raised creatinine, low albumin, and may be related to gastrointestinal disease. Antistreptolysin O titer, anti-dehydraoxyribonuclease B or anti-DNase test, and this test is used. The investigation is used to confirm preceding streptococcal infection, and this does not exclude HSP, as it may precede HSP. Urine investigations where there can be hematuria where hematuria may be evident, and proteinuria. Septic screen is used if diagnosis is unclear and purpura is present. And in around some of the clinical pathological findings, so significant clinical pathological differences with IgA nephropathy, renal symptoms or symptomology in around 30 to 70%. Some young adults develop rapidly progressive glomerulonephritis. There's a higher rate of renal involvement in children, pediatrics and children ages 10 to 18, and associated with atrophy in a third of respiratory in one third of where respiratory infection may follow. And there's related to IgA nephropathy due to elevated serum IgA circulating immune complexes with IgA creates create similar kidney create sort of similar kidney or renal lesions. There's high serum galactose deficient immunoglobulin A1 level in A1 level in which is also demonstrated. Arterial blood pressure, serum creatinine, proteinuria, cellular crescents, glomerular necrotizing lesions, and chronic renal lesions are associated with the development of renal failure, or chronic kidney disease, or CKD. There are variable recurrence rates after renal transplantation, where recipients are transplanted. However, it is not clinically important. So, in sort of summary, as part of this poster presentation from 2022. HSP is considered sort of rare in some regards. It's considered rare in some regards. However, systemic and non-thrombocytopenic vasculitis affecting most between the ages of ages of 2 years up to 10 years and 10 years and where some may be diagnosed as a in amongst their adolescents. In this group, or in this group, or amongst the pediatric or young population, the outcome is almost always excellent, and tends to require sort of follow-up, tends to require nephrology or kidney care follow-up. Excuse me. In other age groups, atypical presentations are common. Renal complications, and to a lesser extent, pulmonary and neurological complications can be severe, and can be difficult to diagnose without a biopsy of the affective system or systems. Urinalysis is one of the sort of main investigations required in a classic presentation of HSP. Further investigations may be required if diagnosis is unclear. Abdominal symptoms can be severe, or where there is evidence of renal involvement. Most cases are self-limiting and require only symptomatic management. However, close follow-up is critical to identify significant renal involvement, which requests intervention. And such renal involvement can also be asymptomatic. That draws this audio podcast to a close. This audio podcast looking at HSP, and looking at HSP and sort of a biomedical and clinical anatomy practice on this multidisciplinary, or MTD, condition. This has been an audio podcast as part of a Meteor edition. This audio podcast has been part of a Biome bullet. This audio podcast has been part of a Lobostics Phantom, and this audio podcast has been a part of a Storm Lobostics production.